Othello's iconic opening dialogue from Shakespeare's Twelfth Night says, if I remember correctly, if music be the food of love, play on, give me excess of it. I remember reading those lines very vividly as one of the first pieces of literature that I read when I arrived in boarding school. But by that time, my own understanding and experience with music had evolved because I have been a lifelong student of music. And of course, by that, Shakespeare meant perhaps music feeds into this entire feeling of love. But what I can say is that it also feeds into various other feelings and facets and aspects of our lives, not restricted to love, but also it can serve as food for thought and certainly as an embalming, therapeutic, calming, reflective sort of space. And that probably is true of, if not all, many art forms and expressive arts. But certainly, music does that. I mean, the fact that music is a stress buster to many, many of us who have absolutely nothing to do with mental health or understanding of it. Very instinctively, we are drawn to music and we listen to it in all kinds of situations. Proves that it has this very sentimental and emotional quality. And to explore it now because it is becoming more and more formally used, and I'm delighted at that, as a therapeutic modality in the form of music therapy is the reason we are meeting today. This is of selfish interest to me because, like I said, I remain a lifelong student of, particularly of Hindustani classical vocal and Hindustani music. And joining me is an extremely special and gifted musician and singer herself who has studied music therapy, and she has been using that as a very effective modality and tool in the wonderful work that she's been doing. So we are very grateful that Raina D'Mello from Delhi stroke NCR is joining us for this wonderful conversation. Like I suggested earlier, music has this therapeutic quality, which is why we're calling this edition Melodies That Unchain. Pardon the cheeky pun from Unchained Melody. I couldn't help it. So, yes, this is yet another edition of Talk Therapy brought to you by Driveway Devi. I'm Karthik on behalf of Driveway Devi, and I would like to extend a warm welcome to Raina and lots of gratitude for making the time to do this. Hi.
Hi, thank you so much for the amazing introduction. It's really an honor to be here and to be able to discuss this with you today.
Wonderful. Now, I usually mess up introductions of my guests thoroughly, so I've stopped doing it. So, before we jump into good vibrations and such, why don't you, for the benefit of our audience, in your own words, tell us a little bit about your music and your work relating to music therapy?
Okay, so I have been playing music since I was about 9 or 10 years old. Actually got my first electronic keyboard from my grandparents when I was about 10. And within a year, I started performing, and like I performed at my first concert through my music school. And the years have gone by in performing and learning, unlearning, having a gap in music, and but still having music in my life, to doing it to fast forwarding it to college time, where I actually pursued a triple major in music, psychology, and English, where I majored in piano at Christ University, and I also sung in the course choir. So that also gave a very enriching experience, I would say. And since then, I've been working actually as a corporate slave. We say it as corporate mazdoor nowadays. I'm working as a content writer. But recently, like a year ago, actually, I delved deep into music therapy through this short-term 6-month course from Chennai School of Music Therapy. And they gave a very interesting breakdown about music therapy. And of course, I'm not exactly certified to be a practitioner right now, because it was just a 6 months breakdown, and I would have had to do some internships and do the rest of the PG diploma to be able to get into that field, and then have an exam for it, and then getting into actually practicing it. But I have got a very interesting understanding of music and how it's used in therapy, which is what we can definitely discuss today with Driveway Devi. So, yeah, let's get into it then.
You're very modest, and I've told you this several times off the record, so to speak. So let me just say it in front of everybody. Please go and check out her music, her singing. She's a prolific singer. And so it's interesting because a lot of people, for no fault of theirs, would have a slightly vague or unclear sense of what music therapy is. Why don't we begin perhaps by you sort of telling us in layman's terms what really it is?
Okay, well, I would say music therapy is a very holistic approach. Um, to non-musical goals that we have in our, like, that we would like to work on ourselves. Say there is a music therapist who wants to, who has a client coming, a patient coming in, and they may have certain issues, maybe like with their self-image. There are certain techniques that are used relation to music, which can help the client feel better about themselves. So I would say yes, music therapy is definitely holistic. It looks at the person as a whole. It's not just maybe one sided. It works in alliance with medical and healthcare professionals as well. So it's like an allied, uh you know uh, what is the word, allied health
Right. Okay.
protocol
Yeah. I mean,
basically.
that makes sense. Now, I'm going to jump in here. You have kind of, preempted a question that I would have asked you a little bit down the line. But that very critical and interesting example, specifically that you cited of somebody with body image issues, at some point, I would have in any case asked you, because understand that again from a layperson's perspective and for the audience who's listening in, we need to understand, boss, I have this. So in these situations, can I try out music therapy? So because you mentioned body image, what would be, certain situations or types of problems or distress in which music therapy could be effective or could be worth trying?
And you are, just to clarify, this is about body image, right?
हाँ मतलब like you mentioned body
Huh.
image, what are some other specific
Okay.
scenarios in which an individual could seek music therapy and hope to have some positive results?
Right. Okay. So, the word here we will use is demographics, because there are different types of people that come. It's more like that instead of situations and, you know, uh, more than situations, it's about conditions that people have basically that they come to, and each person has different difficulties that they face
Sure.
basically. So it starts, I mean, I wouldn't say there's a start and end, but people start going for music therapy when, well, they are in the womb of their mothers also. So there is a whole field about like neonatal, prenatal music therapy, where the music therapists give music therapy to the mother, and then also giving, basically just trying to help the mother calm down
Mm, mm, mm.
themselves, so that the baby is also in a calmer state. Then there's for pediatric, for the children and for the infants. Then there's for adolescents, teenagers who are either going through neurodevelopmental disorders like ADHD and autism, or it could be just them struggling with, like we mentioned, body image issues, self care, and issues like that. So everybody comes with different, you know, problems in that sense, or issues that they would face. And each person is, it's like a sort of unique approach. Like for example, now I've talked about a lot of active, like I've talked about a lot of people who could get into the verbal aspects and even maybe talk about it, but there are also situations such as maybe palliative care, geriatric care,
Hmm.
people
Hmm.
who are non-verbal, people have been in neuro rehab as well. This is a very, very transformative form of
Yeah.
therapy, which has proven to be effective for people who are in comas as well, and who
Right.
have had severe brain damage, whether it has been from since birth, or it has been maybe they've gone into an accident or
Correct.
have
Correct.
had some complex surgery. So it's music therapy is for everyone, I would say, to answer your question. But I would also say that music therapy is also for those who want it,
Hmm.
because you can't just expect a person to get into therapy, music therapy, until and unless they want to, and if they have an interest. So there's a lot of criteria also that comes in, like a lot of there's a whole process as to how a client is taken into the music therapy session. There's music profiling, and there's a lot of aspects that go into that. You Yeah.
Raina, I'm going to jump in here only for in the interest of time.
Yeah.
I take that point, and I take the point that there will have to be a certain process to the onboarding, perhaps more detailed than in other modalities for obvious reasons,
Hmm.
and for it to be effective in the first place. But I'm going to ask you some further really silly but completely practical questions, just to sort of increase the basic awareness and education around music therapy. Now, let's compare it to talk therapy, which I feel a lot of people who may be uninitiated in various aspects of mental health or healing, they do know a little bit about basic about talk therapy at least. So my question is that if we were to compare it to talk therapy, how would typically a music therapy session go? Would it be approximately the same duration? Is it just about going to a music therapist, sitting or kicking back and listening to a bunch of music and coming back? Talk a little bit about very practical on ground things that take place.
Right. So, just to sort of clarify, I think that I'm so sorry for the construction noise, by the way. That is really not in my
That's
control.
it's omnipresent across the country.
Yes, that is true. So, one thing about the difference between the two is that in talk therapy, we don't necessarily use, or we actually may never be using music as a way of healing, but it would be like a very small, maybe it could possibly be a small accompaniment, maybe like a relaxing
Let me
music.
quickly clarify. My
Yeah.
intent wasn't for us to compare the two. I'm just saying that if we have a certain understanding of a talk therapy session, that
Mhm.
it's usually 60 minutes and it's
Right.
can be once a week, and yada
Oh,
yada
okay.
yada. In practical terms, how does
Right.
what does music therapy look like?
So the thing is, I really don't have any experience, internship experience or practical experience. So I'm not sure about the practical aspects about that. So I won't be able to answer that. But I can definitely tell you what I have understood from
Sure,
my
sure.
study, right? So because and what I've understood as a student of psychology and a student of music therapy as well, and someone who is also interested in music. So music therapy sessions can last between 45 to 60 minutes, can be 1.5 hours. That really depends on the requirements of the client and what type of client is coming in and stuff like that. So, because there could be, and music therapy has very different types of techniques. So there's
Sure.
active techniques, and then there's receptive techniques as well. So active techniques are where the client is more involved in music making, and composing on the
Mm,
spot,
mm,
and maybe
mm.
discussing about lyrics of songs that have some impact. So there are various techniques. If you want, I can list them out also. Should I maybe name them out a little,
Yeah,
or
I mean, just a few. I'm getting some
yeah?
sense of what you're saying. It makes it's very logical because
Hmm.
depending on what a client is experiencing and their own sort of level of knowledge, you
Yeah.
could, obviously we all know that lyrics themselves can be very powerful in evoking and
Yes.
getting that thought process going, etc.
Yes, so there's lyric discussion, like I mentioned. I'm just giving you the technical
Sure,
terms here.
sure.
There's songwriting, there's in songwriting, it can come as you making instrumental music also. There's also improvisation, which is a very, very interesting component of music therapy, and it's used for to engage spontaneously with your client and sort of
Hmm.
get to know them without having that verbal talk. So when talk therapy types, I mean, there's not like, not to say that in music therapy there are no verbal discussions. There are definitely verbal discussions, at least in
Yeah, but I
spaces
think,
which,
correct me if I'm wrong, what you're probably trying to say, and this happens across the board in terms of the broader realm of arts, is that I think when you don't put a client in a position where they are responding to the stimulus of an art form or a prompt, their responses tend to be a lot more instinctive, spontaneous, and therefore, quote unquote, pure or unfiltered.
sure, in some cases, yes, but in some cases, there is an active working from the top to the bottom, like creating a song, for instance, right? So that is something, again, there will be some creativity and some improvisation there as well, but that is not the same as the improvisation technique. And it will seem spontaneous to the client, but it's actually a lot of work behind the scenes as a music therapist. So then that brings me to the next aspect, where the music therapist actually plans the session beforehand, and there's a lot of planning and execution and lot of qualities that the therapist has to look into. Whereas I would say in talk therapy, it's more like, in this case, it's talk therapy, what I have seen, at least, it's more like, the therapist will say, okay, what do you want to talk about today? And that is also there in music therapy, um, though it's dealt with in different ways.
Got it,
Let's
got it.
put it
Makes
like that,
sense,
yeah.
makes sense. No, I'm also, my earlier point was that as opposed to a traditional psychotherapist asking a client to comment on a certain facet of life in terms of talk therapy, I think there in those scenarios, even if the client doesn't want to, there is an unconscious filtering stroke censoring that can happen as opposed to responding to a artistic prompt which tends to be a lot quicker and therefore a lot more, it can't be premeditated.
Yes, you could say that. It's
Hmm.
very, it will appear, like I said, it will appear very spontaneous to the client, and they might find themselves opening up. And it really depends on the client also, how much they are opening up to you.
Of course, of course.
So that is of course there. But yeah, there are a lot of moments where I, at least I've seen YouTube videos of certain snippets of sessions, and there have been a lot of those like eureka moments. Like suddenly, one day the client will connect, and it's not even just musically responding, but also non-verbally responding to you.
Sure.
That shows that they are, actually engaging with the music and with you. So like eye contact, body language. Maybe someone who comes into music therapy might have a lot of like restlessness, but then maybe one after a couple of therapy sessions, they come to the therapist, and they, initiate wanting to hold the instrument in their hand. So these type of non-verbal gestures are looked into a lot more as in music therapy, I would say, and that gives a lot more insight also. And it's very
Hmm.
important for music therapists to be very observant about these little clues. So and that helps the therapy get better, basically.
Absolutely. Fine. Now, you had also mentioned earlier, so I just want to specifically clarify that is it in most cases, is it so that music therapy will likely work in conjunction with another modality or as a complementary modality to something else, or can it, does it also function purely independently?
Right. So, as far as I have learned, it can definitely exist, coexist with another modality such as art therapy and music therapy. Stuff like that can be possible. There is nothing to say because expressive art therapies are all, under that one umbrella. Of course,
Correct,
they have
correct.
different nuances to each of them, but there are ways where you can incorporate movement therapy in music as well. So that is those mixed modality options are definitely there. Like, yes, coming to that, now that I thought of it, there is actually one technique which involves art and music, which is
Mm-hmm.
called music drawing narrative,
Mm-hmm.
wherein you listen to the music and you draw a picture based on what
Whatever
you
you're feeling
infer from the music.
right.
Yes, and then there is a discussion after that. What were your thoughts about it, and what is the story behind, and how did you connect it with the music? So, uh, it's a very interesting concept. So yes, number one, it can coexist with other modalities, and yes, it most likely it will be in a junction to the maybe, like, say if it's in a hospital, right, there it will definitely be side by side. It's an allied health intervention.
Hmm.
I am not able to gather that specific word right now. I have studied this course a year ago, so forgive me if
Not
anyone
at
is
all,
listening
not at
in
all.
and
Uh,
they point out any mistakes. I am just giving a disclaimer now only that please forgive me.
No, no,
So
I'll tell
yeah.
you why I actually asked that question in the first place is because
Hmm.
one finds more and more these days that for several reasons, there are certain, I don't want to use a negative term, but uh, okay, let me put it this way. A lot of traditional psychotherapists, along with their primary talk therapy modality, and whether within that they're doing CBT or whatever it is, have started to suggest complementary avenues. Some say do some yoga along with it, some say different things. And there are, therefore, a lot of newer psychologists and therapists are sort of evolving based on their observations and experiences and what they see as possible limitations of a particular modality, hybrid modalities, which seem to be finding greater resonance with clients. Which is why I asked that, typically speaking, would music therapy be suggested in that similar manner along with something?
Okay, you meant as in terms of with psychotherapy, right?
Yes, yes.
Okay. Well, I am not in the. I'm not as an active
In the
practitioner in
right.
as a psychotherapist, so I cannot comment on this. But I'm sure this, as you mentioned, there must be research going on, ongoing research, because there has been research about music therapy and all these expressive arts therapy that have been developing over the past few years, and is gaining relevance. And the good part about music therapy in India is that we already have a lot of basis of music therapy rooted in our own culture.
True.
For example, the whole concept of chronobiology, it actually exists already in traditional healing systems, where we kind of sing a certain rag at a certain time of a day.
Sure.
And since you are in Indian class, you have interest in classical music, I thought I would bring this up, because this is something very interesting, how certain rags have different emotions and moods, and they can
In fact,
ignite.
so much so that I mean, I sometimes have pondered this question whether it is a consequence of my training, but I suspect it's not, because I've tried intentionally to sing certain rags at very different times from when they're supposed to be sung, and they sound so odd.
Yes, because each rag, I mean, maybe one rag may have different relevance or gives a two different dual effects. Maybe in the morning it will have a certain effect, but in the night
Correct.
it has a different effect. So, that aligns with the biology of our, like, our human
Yeah.
ecosystem, right?
Yeah.
Like, eating at a certain time, sleeping at a certain time, um, nourishing our body in different ways, etc. So all of this wellness, one word that I had, yes, as I had forgotten to mention this, but there is one word called salutogenesis,
Hmm.
which is what is heavily inspiring music therapy these
Okay.
days.
Okay.
So salutogenesis is basically a holistic approach to health. It's not just about the curing of a disease, but it's also about preventing and about constant care and, recovery and life after recovery, basically promoting good health throughout, whether you are even having any problems or not right now, but it's just focusing on your well-being overall, physical, mental, social, everything well-being. So that's essentially what music therapy also focuses on. Yeah.
Finally, then, I tend to ask this question at the beginning. If you don't wish to get into it, that's also absolutely fine. But I know that there has been a very, very sort of personal and profound journey that you've had, given the family that you have, which has probably informed many decisions you've made relating to the study of psychology in the first place, without sort of breaching any boundaries you don't wish to. Give us a sense of why you decided to study music therapy.
Okay. Well, initially it was more like a sort of interest that sprung up because I have done music and psychology as separate fields, as in I studied them as separate subjects and gone sort of deeper into music, deeper into psychology. But I have always felt this connection between the two of them, and I had vaguely heard about it, and I even touched upon music therapy as an expressive art therapy in my college, like my last semester, where we had a certain portion about expressive art therapy. So that is where my interest peaked about it. And I had put it off for quite a long time. But, when I got to know that this course was taking in batches for the previous year, I signed up immediately. And, I've been wanting to know more about it because we all know, right, that music has healing properties. It has a way of getting into your heart when words cannot there's a whole quote, right? When words fail, music speaks.
Sure, sure.
So I feel like music gives us freedom to express our emotions, and it also invites and embraces all sorts of emotions, which is why it's such a beautiful way of using for yourself, whether you're using it to connect with other people or you're connecting with yourself, or you know you're trying to explain to someone else how you are feeling, or you're trying to understand how they're feeling. It's a very it's transformational. And the more people get to know about it, the better, honestly. And I think this is why we're here today, to spread awareness about it, because uh, you know I know for a fact that when I was young, music has been quite a big impact on my life, and it's been there for me. I felt like it's been like my friend by my side, no matter what.
I
Whether
think for at least both you and I think for many others, it has been provided solace, safe space,
Yeah.
escape, refuge, whatever you want to call it.
Yeah, exactly. So, whether it was me listening to music back and forth from my school, because I had a very long journey when I was in primary school at one point. So, the journey used to be long, but the CDs that we used to play in the cars used to keep me completely entertained, and I would just be vibing. And, that's one aspect about like listening to music and finding comfort in it. The other comfort that I have felt, or the feeling, I think more than comfort, I've also felt a sense of fulfillment,
Mm,
and
mm.
that has I felt that a lot with music teaching. So one other thing I forgot to mention is that I also do teach music, and I have been teaching for a few years now on the side. whenever I can. And I've had these online students as well. And um, I don't know, I just feel so good expressing my love for music and
Yeah.
getting youngsters. I mean, I'm also a youngster, but even younger people than me, like the teenagers, current
Yeah, yeah,
teenagers,
yeah.
getting them engrossed and engaged
Sure.
in music is so exciting to watch. And
Yeah,
then when
yeah.
they come back to me and they tell me that, I took your advice about this and now I'm using this approach. And in fact, a
Hmm.
student just
Hmm.
texted me today and said that I'm using the approach that you taught me.
Hmm. Hmm.
So it feels so amazing. Like,
Yeah.
there's so much you can do with it. And no matter, I mean, even if there are certain scales or certain, we have certain frameworks in music, there's always going to be theory about it. But then when you I mean, no matter how many fixed set of rules, so-called rules that you may have in music, you have, but you can make unlimited melodies, and
Of
those melodies
course.
are what Unchain us. So
Very,
that
very,
is,
yeah, that's really poignant and true, actually. In
yeah.
any case, my very rudimentary understanding, by and large, of Western music is that, yes, it is very sort of, tends to be very notation driven. I think there's a little more sort of liberty and playfulness, perhaps, in Hindustani. I always describe it as a walk in a park. So you have the park boundary defined, but then what you do and what motion you take within the park is entirely up to you. And that's where the fun
Absolutely.
is. So,
Yeah.
great. I mean, thank you for sharing so candidly and openly. I want to ask you a slightly cheeky question and put you on the spot right before we let you go. When you listen to a piece of music, have you observed whether you tend to be drawn first to the melody or to the lyric?
Um, okay, this is an interesting question. It really depends on the music, right? Because if it starts with a lyric, then I will definitely focus on that first. But then if it's something that has a hook, I prefer my music to have some sort of intro
Sure.
before the vocals start, because it sort of gives like something as a summary of what to expect. It's a very mathematical way of putting, a very logical way of putting it, but I just think that it's like a prelude.
Yeah,
I mean, musical terms, it's like a prelude to what
sure.
is coming, or maybe it's like a little hint that, okay, you might see a bit of this, a bit of that. We're not telling you everything right now, but you'll find out. And
So I
uh,
totally get what you're saying and actually resonate with it and agree with it. It's just that sometimes, like is the case with human beings, where you see the visual first, you find a person
yeah.
attractive, and then they open their mouths and it can go south. That can
That
always
is
happen
true.
in
Yes,
music.
exactly. I have heard music where the lyrics, where the instruments are beautiful, and I'm like, okay, this is going somewhere. And then I hear some lyrics which
Yeah,
don't make sense to me, and the way it starts is like a and very certain
yeah,
vocal texture which is very nasal and very crude, and I just cannot deal with that. I
yeah.
immediately change it. I'm like, okay, there's something building up. Oh, oops, forget I ever opened this song. uh, but there are songs where I especially like when I feel like the instrumental bit is maybe simpler in that sense, because I love listening to complex music and having multiple parts and having to figure them all out. Oh wow, this is happening, this is happening.
Hmm.
So when there is stuff like that, when it's simpler, I tend to focus on the lyrics more.
Yeah,
Where
makes
there is,
sense, right? Because
yeah.
you have the sort of capacity to do that. It's like I suppose it's like eating a very simple dish. Then you can focus on one or two ingredients.
Yeah, it's just that when the music is simpler, the lyrics come out better in that sense, when there's
Yeah.
not much
Which
going
then,
on. But
of course, tends to happen
mm,
with acoustic music. I mean, what immediately
yes.
jumps to mind is a song like More Than Words, for example, where it's just, acoustic guitar strumming, and then you are completely focused on the lyrics. Great. It's been lovely chatting. We wish you the very best. What really comes, what is palpable, even on this extremely impersonal Zoom call, I will tell you, is your passion for music, for everything related to it, and which is the kind of people we love seeing getting into and inhabiting a particular realm. So, all the very best.
Thank you
And
so
it's been lovely
much.
chatting, and we'll be in touch.
Sure, definitely. It's been my pleasure having to, talk about something that I feel like is my purpose in life now. I definitely made it a point to make sure I get into music full time at some point. That's my dream. So I will keep updating you, of course. But yes, thank you so much for this space and letting me express it all out here. And I hope some melodies have unchained, some discussions
I
about our
hope
melodies
so.
have
I hope so. And
unchained
in fact,
people's.
whenever you feel like, and we should do like a, let's say, 6 months hence or a year hence, where you've evolved and you've had a certain, a sort of basket of experiences. Come back, chat with us again.
Definitely. Would love to do that.
All right, great. Take care.
Okay. Thank you so much.